My name is Charlotte Cummings. I'm originally from New York and have been in Chicago for 57 years. I am 81 years old. I've always tried to walk a lot, and I would normally do 10, 12, 15 blocks around, no problem. When things got bad, I would walk half a block and lean on a wall to catch my breath. My main symptoms were shortness of breath and fatigue. 16 years ago, I had a quad bypass, and then I've always had slight to moderate mitral valve prolapse. And then 4 or 5 months ago, it went to severe.
People with severe mitral regurgitation often have symptoms that creep up on them. Many of us seem to accommodate any kind of symptoms we have and we adjust our lifestyle. But people with severe mitral regurgitation, they develop heart failure.
So Ms. Cummings had mitral valve prolapse. Now typically we would offer open heart surgery with mitral valve repair for patients like this. However, Ms. Cummings was not a candidate for open heart surgery. So hence the MitraClip therapy was an excellent option for Ms. Cummings.
The MitraClip is a device that was designed to bring together the two leaflets of the mitral valve. So in mitral valve disease resulting in regurgitation, the mitral leaflets don't come together fully. And so this is almost like an alligator clip that fastens the two leaflets together to avoid them from being overly redundant or flopping too much, which can result in regurgitation or backflow of blood.
I was grateful when I heard about this because there was no way I was going to go through an open heart surgery again. I've had enough, so I was very grateful, believe me.
The MitraClip therapy does not require surgical incision. It does require placement of a small catheter, typically through the groin, which does not require any sutures or staples to close. Most of the patients can go home the next day or the following day after the procedure.
After the procedure, I really immediately felt very well. I was out and wandering around and doing more distance than I was able to do in the months prior to the procedure. So it was wonderful, just wonderful.
Well, Ms. Cummings is doing great. We've talked to her on the phone. We've seen her back in follow-up, of course. She's a different person. She's very upbeat. She's the way she should be. She's now got a competent mitral valve. She can go about her business.
I would particularly like to thank Dr. Ricciardi, Dr. Malazeri, and Dr. Melman, my primary cardiologists. Wonderful men, very attentive, and I'm grateful to them truly. I think anyone that has this situation with the mitral valve would be very wise to speak to their cardiologist about it. I have friends that have done this, and I know that their lives are greatly improved as well. It's so very simple. When you consider what they're doing to improve your life, there's really not much to it. A night or two in the hospital, my gosh, for me that's nothing.